All right, moving on to our yellow section for urgent care issues. So just to reiterate from before, whenever possible, people should see their primary care doctor for all non-emergency issues. Urgent care is to be used on the weekends or the evenings or holidays for any kind of primary care doctor thing when the primary care doctor's office isn't open, the primary care doctor's on vacation. You're going to use urgent care for PCP type issues when the doctor is not available within a reasonable time frame. They're like, yep, we hear you, we do not have any openings for the next 3 weeks. So if that's the case, then you can go ahead and go to the urgent care, and the urgent care doctor can forward the records and labs or whatever they may have done over to your primary care doctor, and you can follow up with them. And also reiterating from the introduction, you always want to confirm that the urgent care center that you've chosen is not actually a freestanding private emergency room. And if it is and you don't mind, that's great. Just know that there's going to be extra fees. So any change in pattern or frequency of normal symptoms. So say somebody's got chronically high or low blood pressure and suddenly it changes, but it doesn't change to the emergency room level, but it's a sudden shift, that should probably go to urgent care. So anything over 160 over 100 or under 90 over 60 with new symptoms of weakness or lightheadedness. With the high one, you might see symptoms also of weakness or lightheadedness. Sometimes people will have a headache, or they'll describe just feeling wrong. And they'll feel anxious. So either of those scenarios, or blood sugar changing and going up to above 200 but below 300. So those are all urgent care scenarios that really should not wait more than 24 hours before you're seen by a doctor, but they don't necessarily have to go to the emergency room. Difficulty breathing that is progressing slowly could potentially also go to urgent care depending on what's available. Any change in pattern of a pre-existing chest pain. So if somebody already has angina, which is intermittent cramps in the blood vessels in their heart, they'll often know what their sort of normal is. If there's a change in that, or if they have heartburn and then suddenly have a new kind of chest pain, that should be followed up on fairly quickly, assuming that they don't have all the other symptoms of a classic heart attack. So if it's just pain in the chest with none of the other symptoms, then that can go to urgent care. Sudden swelling of a single appendage, that can go to urgent care. It shouldn't wait for 3 weeks for the doctor. It might go to the ER, but I think you'd be seen more quickly at urgent care, and they can do a quick triage and decide if you need to go to the emergency room after that. A nosebleed that won't stop, urgent care centers should have a way to cauterize that. They'll take a little stick and make it stop bleeding. Anytime feeling the heart flutter in the chest long enough to cause shortness of breath, it's happening frequently during the day, but the pulse is regular, and it's between 60 to 100 beats per minute. So normal speed pulse, and it's regular rhythm, so it's not skipping around when you feel your pulse in your neck or your arm, but you're feeling heart flutters often enough that it causes shortness of breath. You need to get that checked out within 48 hours. If you suspect that you have a likely urinary tract infection, which is painful, urgent, frequent urination, especially if there's low back or mid back pain or low fever, that can go to urgent care if you don't want to wait for your primary care doctor. If you suspect that you have pneumonia, bronchitis, if you have a fever above 104, if you have a fever, headache, stiff neck, but it's not getting worse, any of those can go to urgent care. All of those could also go to your primary care. You would go to urgent care again if your primary care can't get you in within 24 hours. If somebody's got pale, clay-colored stools with stable, low-grade pain, kind of just colicky pain in their upper abdomen, and it's been going on for a little while, a week or two, or a few days, these are all signs pointing to there being some gallbladder congestion that has not become a blockage of the gallbladder duct. It's not a medical emergency, but it does need to be assessed for severity, and probably will need to be referred to like a GI doc for evaluation. If somebody's vomiting blood or coffee grounds. Vomiting bright red blood usually means there's a vein in the esophagus has ruptured. Usually they're not able to rupture unless they've become varicose veins, which usually means there's a liver problem. If somebody is vomiting coffee grounds, it often means that there is a bleeding ulcer in their stomach. So both of those do definitely need to be worked up relatively quickly, but they're not medical life-threatening emergencies where somebody's going to die in a few hours, right? Severe prolonged diarrhea with lightheadedness. If someone's becoming lightheaded or they're starting to get leg or arm cramps, this is a sign that the diarrhea has gone on long enough that it's caused their electrolytes to become depleted, and they may need rehydration at an urgent care center. If someone has a headache or vision changes after hitting their head, but they did not lose consciousness, they do not have uneven pupils, they don't have a lingering headache, and at no point were they disoriented, then they can probably just go to urgent care and they can give them a quick once over and look for basic signs of a concussion. If anybody's got a new onset of numbness in the saddle area, meaning their crotch essentially, but they don't have changes in bowel or urine continence, then this is a urgent care issue, and they may just need to be put on some sort of muscle relaxer to get rid of the muscle spasm that might be pinching the nerves. And last but not least, wounds that need stitches but not surgery. So again, this is lacerations that have gone through the skin. You might be able to see muscle or fat, but you haven't severed tendons or any major blood vessels or any nerves, meaning everything works. Then those can go to urgent care. Infected wounds, painful, red, some discharge, those are going to need antibiotics. Those can go to urgent care. Burns on a small area of the body, those can go to urgent care. Sudden onset of a rash, especially with fever, or if somebody's on a new medication. If it's a medication that's suspected to be causing the rash, you also need to at least call and leave a message with the pharmacy and with the primary care doctor. But those need to be seen within 24 to 48 hours. So urgent care it is. And then numbness or weakness after a vaccination. Again, the person, whatever provider administered the vaccine needs to be alerted. The primary care doctor needs to be alerted, but this can't wait. It needs to be seen and worked up rapidly.